So I'm here with Dr. Randall Payton and one of his patients just hours after a total joint replacement surgery, and she's taking her first steps. So Dr. Payton, what did we just see happen here?
So I saw a lady who just had a knee replacement just a couple hours ago, got up and walked, and she's walking for her first time. This is what we expect out of everybody. Our goal is to get people back to walking, being able to return to all their activity as soon as possible.
When I was a resident, it was not uncommon for patients to come in 2 days in advance to get ready for their surgery. They'd be in the hospital for 2 days, then have surgery, and then they would lay in bed for 3 days with a pillow between their legs. And then we would get them up, and the average length of stay was around 2 weeks. And now it's very, very common for our patients to go home in 1 day or 2 days and are up walking the same day, which is revolutionary in just a relatively short period of time.
So now I'm here in the group therapy room where experts like Meredith Dracy and Nicole Lynch help patients continue to take more steps after a total joint replacement surgery. Let's start with you, Meredith. Tell me what people can expect when they come to Reston Hospital Center and get a procedure like this.
Total joint replacement has come such a long way over the last even 5 to 6 years. When we start talking about 10 years ago compared to now, it's a huge transformation, a huge difference. It used to be where patients were in the hospital for 2 weeks at a time and they had all sorts of devices and machines, and it was just a big involved process. Now we've come so far and made so many advances that our patients are going home after just 1 or 2 days of having a total hip or a total knee replaced. A lot of it is just improvements in surgery as far as being able to do imaging beforehand and get exact measurements of patients' anatomy so that they're able to get implants that are customized to their unique body and their bone size, and then just advancements in physical therapy and what we're able to do with patients right off the bat. So it's an exciting time to have a knee or a hip replaced here.
Tell me about what makes this program here so unique.
The uniqueness of the program at Reston Hospital is that we have a really multidisciplinary approach with our patients. As Meredith mentioned, physical therapy starts to work with the patients immediately after surgery. Patients often take their first steps only hours after receiving a joint replacement. The therapists work very in tune with the nurses and the physicians to make sure pain is managed well, and the patients do go home at a very high functional level. We practice different functional activities with patients, going up and down stairs, getting in and out of cars, dressing, so that patients do feel ready to go. And as you can see with our joint class, patients also interact with each other, so they can learn from each other and hear about from patients that have had surgeries already or are going through the process at the same time.
Now, I see a lot of the patients here also have their family members with them. Tell me a little bit more about how you really make sure that the patients are comfortable during their time here.
Yeah, so that's one of the things about our program that we really love and that we're proud of. It starts with education before surgery. All of our patients, about 90% actually, are able to come to a class here at the hospital that I teach, where family members and friends can come as well. And we talk about the entire experience and what to expect, and we prepare them and let them know all the people that they're going to meet and what the schedule is like and how we're going to manage their pain. And every time after class, patients leave and they say, "I'm so glad I came. I feel so much better and I feel so prepared, and you really put my concerns at ease." So when people come in, they say, "Yep, I knew that was going to happen. We were told that ahead of time, and we allow them to stay overnight. We have sleep chairs in the rooms and an open visitation policy, so family members can come and just cuddle up in bed next to them if they want." So it's a nice environment.
And talk about patients after the surgery. Are they able to go back to their regular functions?
Yeah, patients often go back to all of the regular activities that they were able to do before surgery. Of course, that's surgeon dependent and patient dependent, but yeah, they go back to work very quickly. They go back to taking care of their home and their family members and really get back into the community very quickly after surgery. Many patients, as Meredith mentioned, are only at the hospital for about a day, and they go home walking, climbing stairs, doing a lot of the activities that they were able to do before.
To me, this sounds amazing for anyone who needs a total joint replacement. Talk about the goals with the new technology that you're using here that really sets the program apart.
So, our community here, we have a very active community. Our patient population group, we have a lot of patients, they're working, or they're playing golf regularly with some of our surgeons, and that's a big goal is when can I get back on the golf course? When can I get back to work? When can I get back to doing all these great things in Northern Virginia that I was doing before the arthritis kind of took over my life and made it so where I couldn't participate in all this great stuff? So, our goal, number one, when they're here, is to manage their pain and be able to get them home safely so that they can resume all these activities. I talk to patients all the time, 6-8 weeks after, and they're like, yep, I'm right back on that golf course like I wanted, or I'm starting to run again after having a hip replaced. So that's our goal, is to have this cohesive program where everything's running together smoothly, safely, optimize these patients and their health and their outcomes, and just get them back to doing all that stuff that keeps us so busy in this area.